Ontario's healthcare crisis continues as many hospitals report unprecedented levels of staffing shortages. According to Ontario Health, 13 hospitals have had to temporarily close emergency rooms since the end of June. The province says it hopes to ease pressure on the health system with a plan it calls the Plan to Stay Open. It includes having publicly covered surgeries take place at private clinics, waiving exam and registration fees for internationally trained nurses, and introducing legislation today that would send patients waiting for a long-term care bed to a temporary one in a home not of their choosing. Paul Calandra is overseeing that legislation. He's Ontario's Minister of Long-Term Care. Hi, Minister. Good to have you back on the program.
Thanks for having me. I appreciate it.
Minister, in announcing the introduction of this legislation, you said there would be guidelines, for example, on where the patients would be moved, how close they might be or not so close to family members. When are those guidelines going to be released?
Very soon after the bill is passed. My goal right now is to have the bill passed by no later than September 1st, and to be in a position to release the regulations with respect to guidelines no more than a week after that. I want to make sure that there is no uncertainty and that people are very comfortable with what it is that we're doing. And until that point, we're going to be obviously with a lot of consultations throughout the sector.
Let me ask you, on behalf of people who have family members in that sector, I'm just thinking of them listening and how they might feel it's a bit counterintuitive to find out what the rules are going to be to govern this after it's already law. Why not provide those family members and the people who might be affected by this legislation with those rules before it becomes law and right now?
Yeah, well, we'll be working with family councils, resident councils, all of the stakeholders within the industry to come up with the rules. So it's not something that we're just going to be mandating without talking to people. Look, I understand that there are some challenges that people will face with this. Our goal is to keep people as close to the homes that they have selected as their preferred homes when they move into long-term care, into their permanent long-term care home. Keep them close to family, to friends, to their spouse. That is going to be the overriding principle of what it is that we're trying to accomplish as we free up some spaces in the acute care system. And
I certainly do understand the goal of wanting to free up those spaces, but let me ask you bluntly then, when you say the goal is, for example, to keep them close to their preferred home, which in many cases is a home close to their loved ones so that they can actually see people and not live kind of an isolated life there. Do you mean you won't move someone, an hour, 2 hours away from where their family is? Will that be a rule? Will that be something firm, or is that just a hope and aspiration, and should families be worried as a product of that?
No, the guidelines will be very specific as to what it is that we're planning, what the distances will be. There will be differences between, urban and more rural homes, remote homes, obviously. But we're going to work with stakeholders very, very closely, with residents' councils, with hospitals, ultimately, to make sure that people are as close as possible to the home that they have selected as their preferred home once they go into long-term care. I think we can accomplish this. And look, for the first time, Ontario long-term care homes are in a position to be able to be part of the solution to the acute care challenges that we've been facing in Ontario, frankly, for decades. And it's because of the investments that we've made. And I think we can do this responsibly and in a fashion that works for everybody. But I do understand this does come with some challenges, and there are some opportunities and people, some fear. But I want to mitigate that and make sure that people understand very, very quickly what it is we're trying to accomplish.
And I think you're right to acknowledge that, right? Because this does, I can think, I've had a grandparent in long-term care. It would make me very nervous to think if they were going to be extra far because they counted on seeing us so much, right? You're saying as close as possible, but you really can't provide any specific assurance. I also, that's how I'm interpreting it as well. You're going to do the best you can, but you can't make any guarantees. And I wonder then, again, if I'm in that position and I'm thinking, is this really the best policy to pursue? I acknowledge the goal behind it, but I'm worried.
Yeah, no, regulation will provide that guarantee. But I will say this, we learned certainly during the pandemic how important it is to have your loved ones close to you. They perform, not only that opportunity to see your loved one, but they perform so many things for their loved one in long-term care. So in order for this to work, in order for it to be effective, we have to have the loved ones close to their family members. So we're going to do that. But it is also very reflective of the fact that once a doctor has decided that you can be discharged from a hospital The best care for somebody who is already on the long-term care waiting list is in an actual long-term care home. There will be a host of other services that come with the programs that we have announced today. But I do, look, Vashi, I'm not going to, there's no point in denying this until we come down with the regulations and until people can see what is it? What does he mean by distance? How close will he be? There will be uncertainty because, many of us have been there, as you said. So that is going to be the goal of the program so that we have these caregivers, family, friends, spouses still able to meet with and be with their family members.
Are you moving?
While they wait for
right. Are the temporary homes exclusively for profit? Are they going to be privately run?
No, they'll be for-profit, not-for-profit municipal homes. Look, we're building an integrated long-term care system in the province of Ontario. But it's more than that. It's like an integrated healthcare system, which really started when we brought in Ontario health teams. This is an evolution of it. And to say we've never in Ontario been in a position where long-term care can actually be part of the solution to the acute care challenges that we faced, and now we can be. And it's very reflective of the fact that, look, if you're on the long-term care wait list, the best place to wait for long-term care is in a long-term care, freeing up those acute care beds for other people who really need them.
And just to sort of circle back to the question, though, and I'm here from your
Sure.
answer that it would be a mix. And I'll tell you why I'm asking, and you'll be well familiar with, of course, this whole debate raging about privatization and the charges from the opposition, especially where long-term care is concerned. There are people who are pointing to statistics that show for-profit homes had nearly twice as many residents infected with COVID-19 and 78% more deaths compared with non-profit homes. Do they not have a point in raising their concern about the level of privatization and using long-term care homes as an example of that?
Yeah, look, it might surprise you to learn that I believe that when homes have failed in the past in the province of Ontario, and there's no secret, look, Ontario was not prepared for the global pandemic in 2018, 19, and 20. Our long-term care homes were not prepared for that. We have made substantial changes to how long-term care runs in the province of Ontario. The Fixing Long-Term Care Act. We are on our way to 4 hours of care. We're building 58,000 new and upgraded beds across the province. We're hiring 27,000 additional PSWs. We gave our PSWs a raise. We're paying for their tuition. We've hired double the amount of inspectors. But ultimately, I think when the system fails, it has to come back to government. And for decades, long-term care was not a priority. But we have changed that through the Fixing Long-Term Care Act. And we are ensuring that all of our homes meet the standards that people expect, whether they're municipal, not-for-profit, or for-profit.
I guess that my question is more around the idea that various stakeholders and opposition parties, but stakeholders too, are concerned about other aspects of the announcement today when it comes to privatization. The idea that your government will clear the surgical backlog using more independent facilities, that there's no, it doesn't seem like you're committing to keeping the cap or never saying that the cap is going to be raised on that. And they keep pointing to long-term care homes. I take your point that you've made it a priority, but in the first part of your mandate, it was clearly not. And what we saw was that the private sector delivered worse results for people with COVID-19. Yeah, I know that's just one part of it, but I think people do have genuine concerns about applying that mechanism or that type of solution to other parts of the sector which are in crisis right now and ending up with worse outcomes.
Look, Vasha, we really made long-term care a priority right after we were elected. It was part of our original campaign promise to start rebuilding.
Respectfully, though, the pandemic did not show that.
Well, let me finish, because you're right. The system showed that Ontario, and not only Ontario, let's be honest, across this country, we were not prepared to deal with a global pandemic, but we have learned from that. Vaccinations, for instance, have made a huge difference in long-term care, especially in the province of Ontario. Many of our residents have not only had their first and second doses, but have had their boosters, their fourth dose. We are hiring 27,000 additional workers across the system. We've hired a number of inspectors, doubling the amount of inspectors, and we are the first jurisdiction in North America that is moving to 4 hours of care for residents, which is a mix of nursing, dietitians. So to have a fully integrated system, so it doesn't matter whether you're in for-profit, whether you're in a not-for-profit or in a municipal home, the quality of care you get should be guaranteed by the people that you elect to ensure that the system runs well. And that's what the Fixing Long-Term Care Act was all about, and that is what we're doing. And look, as I said, we can make a difference finally in the province of Ontario. And as a long-term care minister, I know that this is the right decision, because this is where people look. The people that are moving into these homes, that we're moving into these homes, if they consent, are people who are on the waiting list for long-term care already, and who will eventually be in a home of their preferred choice.
Okay, Minister, I'm out of time. Thank you very much for your time. I appreciate it.
Thanks for having me, Vashi. Appreciate it.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.